If we have time, we can also, if anyone has questions about the laparoscopic tower setup as well. We're just, so the standard setup, if you're gonna do a colon in the OR, typically the monitor is on the opposite side of the patient. I know gastro's a bit of a different setup. And then scope guide as well. They like to use scope guide, so always kind of set it up opposite. The cables are usually hanging on the back of the endo tower, so you're gonna wanna have to hook those up with the scope guide over here. So it's just a bit of a squeeze and then add it on, right? So, and this is always kind of in front and up and over the bed rail. With the monitor, I think you guys are used to it, but they have that little door here on the back, so you can attach your SDI cable. Okay, so that's the kind of your setup just to get going in the room. Then you have your main power button here. You don't have to power everything individually. Once everything gets turned on, that's when you're going to start to set up your scope. So we have a colon here. You guys always have your tubing kind of ready to go, I believe, because it's the 24-hour tubing. So putting the scope in, you have the dot here. You want to line it up with the dot on here, okay? You have your Christmas tree here on the side of the scope. That's where your suction tubing is going to go. And the other side here will be where your CO2 tubing goes. So you can't really screw it up because it only fits in one way. So to make this easier, I always go in kind of straight, kind of get your positioning, and then turn it and it goes flush against the scope, okay? This is on, oh, this was already on the scope, so I'll just move that. It's just a spare. So that will go here. And then your suction tubing as well. And then you're gonna basically do your scope test, right? So we'll get this going here with the suction first. And you're gonna attach that here. Get your suction. There we go. So next steps. You have your scope. You have a scope hanger here too, so if you ever do a double, you can kind of utilize both if needed. I always like to have a cart right next to it because it just makes your life easier, especially with the colons. They're so long, like they're kind of all over the place. So you can kind of hang your scope here, make it easier for yourself, right? And then you would have you would test your suction in the water, your air water, which is, you want to have to turn on the CO2, okay? Then you also want to just use your flushing pump and get the forward water jet so that everything is working when they're ready to go. So they don't have to mess around. Now, I came last night and installed a flushing pump cable on the back. What that means to you guys is some of the docs now could use the button to activate the flushing versus the foot pedal. Dr. Simons saw it and Fernie wanted it. One of the docs there was injured, so doing this all day with her foot. So we set that up and he liked that idea. So I've set his user settings to that. The other surgeons, I don't know yet if they're going to adopt that. But as you guys know, depending on what surgeon you're working with that day, if you go to the front here, you're going to have the drop-down menu because you want to make sure you select the right one. They all have different preferences for their scope buttons. So if it's on someone else, it's like muscle memory for them. So where they go to take a picture or whatever they want to do, if it's not in the right spot, it throws them off, as you probably know. So I understand you guys have a couple locums, so I added another user setting here called locum last night as well, and I understand you have a new general surgeon as well. So I added in her preferences. So you guys just have to see who's working and then select their name, okay? So actually turn this on, probably turned it off. So any questions so far on the setup? You guys, I know you guys probably see these randomly, so it's kind of, if you have any questions, let me know or interrupt. With regards to the system here, all the scopes are white balanced already to the monitor. If anything ever pops up on the screen telling you to white balance, it could be that the scope came back from service or you have a loaner. So you're just you have a white cup here, you can use a gauze, and your lamp is on already, you're just gonna hold down the white balance button just like you do on all your things, and you'll get the feedback from the monitor. It'll say white balance complete. Now, if you want to bring up the scope guide image, because right now it's not on the screen, you would just hit the PIP, which means picture in picture. Okay, so now you have your scope guide image. You can control the scope guide. Right now it's on split screen. I know they all have different preferences. So you have split screen or regular standard screen. When they are about to insert the scope, there is a scope position button here. It's someone put a green sticker over it so you can see it. That just helps kind of just get things going so everything's accurate on the centimeters. It kind of gives them a starting point, a vantage point. Now, if they ever forget to use scope guide or don't want it, then it's a tough case and they want to bring it in, you could still do that, but your centimeters most likely won't be accurate. But I think they're pretty much scope guide users here from my understanding, so they usually want it from the beginning. In terms of scope guide, the two contraindications are pregnant women and pacemakers. Now, with pregnant women, the studies, we haven't done any studies on pregnant women, but we've looked at to see what the magnification and the field that it provides. They say the safe distance is 60 centimeters and it's no more than your household appliances. So I like to let everyone know, some people still use it. It's really up to you. So it's, if you don't want to be in the room, that's your choice. You could always power off the scope guide processor so there's no magnetic field coming from the scopes. How it works is there's metallic coils built in at every 10 centimeter marker on the scope, and that's what brings up the image on here. So it gives them a good visual of what the scope looks like inside the patient. It helps the patient. It used to be a teaching tool, but now it's become sort of a standard of care because if they see a loop forming, they know the type of loop, they know what technique to use to get out of that loop, so they're not going to stand there forever just trying to get through and not know what it is. So it is a great tool. I don't see the hand coil here, so maybe you guys don't use that. There is a hand coil sometimes that you can use for you guys if they ever ask you to apply pressure. Or, if they're having a hard time, you basically put it on your hand. I don't know where. Do you ever use that, Amanda? No. Okay. I'll just leave that. I won't muddy the waters. It's kind of random. So in terms of the scope guide as well, sometimes you do have to reposition the patient. So you can see the little, sorry, I'm doing this for you guys. The little patient there. So if they do reposition the patient, the buttons here rotate left and right. You can see here, right? So it does help make it more accurate for them. So if they do flip the patient, usually you always start this way, right? The colon. You guys have all seen it. Any questions on scope guide or setup? Yeah.
What does it mean when we have a picture of the scope dancing?
Yeah, good question.
What's going on here? I don't know.
When the snake is dancing?
Yeah.
Yeah, so sometimes it's just positioning of the dish. So if the patient is laying like this, you want the edge of the bum lined up right here, okay? If you're moving this around, the scope is always searching for a signal because that's what the magnetic field here is picking up from the scope. So it could be that this either got moved, wasn't set up correctly. I've seen some people where they're pointing it down here because now, and then the scope, it just does crazy things. So you want to make sure you have it straight, right in line with the edge of the patient's bum when they're in that position. And of course up and over the bed rail because that will also cause issues, some interference, okay? So try that if you do have it kind of going all over the place. If it's changing colors and it's yellow, because normally it's gray, it just means it's yellow, it's accurate, the image, it just means it's kind of still searching for the dish and always searching for a signal. So you could just adjust this slightly, could just mean this has moved. Because sometimes you move things around, you have to reposition the patient. So just try to get it back in the right spot after. Okay? And then in terms of your front panel here, you have end exam and disconnect scope. Now, do you guys enter your patient data in the OR? Okay, so you would go in and I think you probably do it on the fly here because you're not doing a whole slate, right? So you just hit enter patient, like from on the top front here, you do enter new patient, and then you would put in the name. So I'm just gonna just do whatever for now, and then there we go. and then okay, and then that name will come up on the screen, okay? Because otherwise the setup won't allow you to go further. If they start and don't put the name, it's gonna, he or she will try to take a picture and it won't really work. It'll give you an error code because it's set up that you have to put the patient name. I can change that, but it seems that that's your practice. Then you don't have to worry about putting stickers on photos after. So we'll go from there. Now, the other one, so end exam is important because you do put patient data. So before you unplug everything, hit end exam, it closes whatever pictures you've taken and puts it into the patient file. So all those pictures will be with that particular patient, so it's not going to overlap. If you don't hit end exam, it'll just go into the next patient. And disconnect scope is important. So the old towers, you could do those hot exchanges, but now everything's software based. So we want you to hit disconnect scope before you pull the scope out of the tower, okay? So you're gonna hit disconnect scope. While you're cleaning, you can do all of this and get like in your flow when you're starting to kind of, so by the time you get to the scope to remove it, that part is already done, okay? So the other custom function page here, the screen. So this is another options here for the doctor. With the new tower, there's more imaging features. Some of them have them set up on their scope button, some of them may ask you to press them here. It just depends on their preference. So you'll see TXI, whatever imaging you have is going to be on the top right corner, okay? So you have TXI, which that stands for is like texture, color, and brightness. It's just a new imaging modality under white light. There's been more studies on increase in adenoma detection rate. Some of the docs like it, it's a bit filtery, but it accentuates everything a little bit more. Some of them turn it on when they get to the cecum, so it just depends on their preference, or some of them turn it on and off while they're in the case. The other one is narrowband imaging, which you've probably seen, it's been around for a long time. That's that green and blue filter, and that's just what they turn on if they're looking often for Barrett's esophagus, or if they're looking for anything, if they're not sure what they're seeing, it accentuates everything on the surface, so they can target their biopsies. Now RDI is, it stands for red dichromatic imaging. That's a new feature, and you guys deal with probably col and more upper GI bleeds in here. So it's a good reminder for the docs to use that feature, because if you have a bleeder, I just want to show you guys because you can't really show it from the scope without a patient. Usually everything's red and you don't know what you're seeing, right? So you guys can go to the custom page and say, do you want to turn on RDI? It's like an amber light, covers the screen, and it actually shows where the bleeder's coming from, like the darker point. So you can kind of target your clips or whatever modality you're kind of using to deal with the bleed. So it's a really great tool, and it actually calms the room a little bit too, because usually it's like, oh my God, we can't see resection, irrigation, and you don't know where it's coming from. Try to remember to use this tool. I know Dr. Kalkstein, she told me she forgot she had it, and then she remembered and used it, and she thought you'd have to use hemo spray, and they ended up seeing where it came from, targeted the clip, and that was it. They were able to get out. So it is a great tool, and you might as well use it, especially because you guys are dealing with a lot of those situations here, right? That's what you're getting called into in the middle of the night, I imagine. So even if they do a big polypectomy in the case and it's bleeding and they're asking you to get a clip and do whatever, they can turn that on. I was in cases all day yesterday, and they could actually target the clip better, so they don't have to maybe use 5 clips, they can use 2, because they actually can see where it's coming from. So just, yeah, try to remember to use that. It's just here, and you just tap it on, and there's modes 1, 2, and 3. Mode 1 is probably what you guys would use the most, because that's for bleed detection. Mode 2 is if they're about to do a large polypectomy and they're not sure what's below the surface, they can see the deep vessels versus the surface vessels. So that you could be like, oh yeah, there is a deep vessel below this, like maybe let's get a clip ready, or you're anticipating things. So I could send you like a 1-pager kind of describing all these imaging modalities, and you can maybe add it to your, I just noticed you didn't have one there, so I'm happy to do that. So you have enhancement feature, transillumination if they're doing a PEG procedure is also on this panel. And then you have your start and stop for the timer. I don't know in here if they're ever doing colon screening. Sometimes they turn on the stopwatch when they get to the cecum.
They do it themselves.
They do it themselves? Okay, cool. So these are just some of the added features that you guys have, okay? Your printer pretty standard. You guys are used to the printers. I think they just might have replaced this printer as well. So you just have one per page. It just triggers when it's pretty standard. Your CO2, you just have start and stop. Right now it's in the red. I bet just the tanks aren't open. But when your tank starts to get low, you'll see that, so you can make sure you change your tank over. And then the flushing pump as well. You just have the arrow pointing where you want your tubing to go, and the amber mode means standby, and then you could bump up your flow, okay? They usually have, I think, pretty much have it at full blast. So that's pretty much it in terms of the setup and all the new features. At the end of the case, you're going to do your post-procedure clean of the scope before it goes to MDR. So what those steps would be, kind of simple. You guys are probably used to doing this for your scopes, but the new Olympus scopes don't require, I think you're using water here, right?
Yeah.
Okay, perfect. Yeah, you used to have to use, what's that brand?
Metrosite.
Yeah, exactly. So what you're gonna do is you can keep your scope here or whatever is easier for you guys. You're gonna have your basin filled here. You're gonna take your cloth, lint-free, wipe from the top down to the bottom to get all the outside nasty stuff off. And then you're gonna do, actually I like to change this over right away. You're gonna take away your blue button, okay? And you're gonna put in this like credit card type device. The reason behind this is because it addresses both the air water channel at the same time. It combines them. So sometimes people are like, why am I using this? What is this for? That's the reasoning behind it. So you're addressing both those channels, okay? So you're gonna do your suction in the water, right, for 10 seconds, and then air for 10 seconds. So you'll take that distal tip out of the thing. Then you're gonna move over here. You're gonna still have your CO2 where you put your air on from the front of the panel, whatever is easiest for you to get at the time. You're gonna hold the button down for 10 seconds in the water, and then let it go for 10 seconds, okay? And you keep it in the water the whole time because it's spitting at you, so that will protect yourself as well. It doesn't need to, it's not suctioning any air through there. And then you're gonna do your foot pedal for 10 seconds, and then that's it. And then you'll put your scope back in the bin. You also want to make sure, you'll see here, there's a stiffener on the Olympus scopes. It goes to level 3. There's a little dot. You want to make sure that's in the exclamation point. So the stiffener's not on. So it's going to MDR in a neutral position, as well as the locks. You want to make sure, because the docs, they're always using their up, down, left, right. You want to make sure these two locks are far right. So there's a little arrow, and it says F on it, so that means in the free position. So if you send your locks back really tight, and if MDR then misses that, I've gone to scope cabinets and they've all been hanging in the lock position. It stretches out the wires. And then they go to use the scope and they're like, oh, it's, because then they all release when they unlock it, and they go to use the scope and they're like, it's not angulating how I need it. And then the scope has to get repaired. So that just helps save your scope. It's a check you do in the room, and MDR is supposed to do it as well. But I always like to bring that up again. So any questions, guys? No? The only other thing I'll add is all of our scopes have the channel size on the side of the biopsy port here, so that's nice for you guys to know which devices will fit down the channel, because as you know, you have a variety of scopes here. So with a 3.2 for your slimline colons, 3.7 for your adults, and then 2.8 for your gastros. Your therapeutic gastro does have the size of a colon is 3.7, because usually you need larger devices, and it allows for better suction visualization during those bleeds, right? So just make sure you have the right devices.
Can you say again after we finish work? So we have to go to unlock this one?
Yeah,
Okay.
so you're gonna make sure your knob here, your small knob, and then your large lever here is all pushed to the right. So it's in the
Okay.
free position. Yeah.
Okay, thank you.
That's it on the endo, if anyone has any questions. Did you want to go through anything on the lap tower?
Yes.